Thank you, everyone. Can everyone hear me in the back? I hate holding on mics. I need to start doing my karaoke. All right, so this is being taped. I'm Dr. Lee, Amy Lee. I may look young to you. They always tell me in my clinic it's insulting but yet very flattering at the same time. I'm 34. I came out of all my training 2 years ago from UCLA in clinical nutrition, and before that I was at UCLA or USC for internal medicine. So sort of jumped from one place to another. So the win-win situation every time football games in town. But in the past 2 years I've been practicing. I started my own private practice in downtown LA, in the dead of downtown LA, next to Skid Row. And for 2 years now, I've been doing my thing. I opened shop, and basically I've just been seeing patients for both internal medicine and nutrition. I work Monday to Thursday in my office, and on Fridays and Saturdays I decided to get away from my private practice and do basically medical consulting. And on Fridays I work with Dr. Stephanie Hagashi, who you probably heard her talk this morning, or earlier today. And I think basically when we first met, probably 6 months ago, I think we fell in love.
That's right.
Because number one, we're both ADD, and second, we share basically the same philosophy and practice, except she's a DC, I'm an MD, and we have the same goals in our life and our career. It's really to create this thinking that we don't need to depend on medicines for a lot of the conditions that we face today, like diabetes, high blood pressure, obesity, and everything else. But my specialty is in nutrition, obesity, and weight management. And I think that's why we work so well together, because most of her existing patients have these ongoing conditions. And so when I started with her, basically I focused most of my practice with how to address these clients, not only in a chiropractic sense of way of treatment, but also with nutrition and counseling and medical nutrition therapy. And so, I know my talk is supposed to be on about pharmaceutical side effects, medication, things like that. And when I was taking a shower this morning, I thought to myself, there's over, I don't know how many thousands of medications are out there. I can very well, talk about 5-6 different medications that I use in my practice, but it's all boring. It's all the same side effects. If you looked in the prescription, or at least the side effects paper that comes with the medication, it's all the same. Dizziness, chest pain, palpitations, nausea and vomiting, decreased libido. And the sad thing is, you take these medications for depression. I'm going to lose my sex drive so I can feel a little bit peppier. It makes no sense. And so, I prescribe these things on a daily basis. I give medications for high blood pressure, diabetes, depression, anxiety, and even weight loss. I'm sure everyone has heard of fen-phen. Maybe some of you have taken it. But it's been called off the market, or at least pulled off the market 10, 15 years ago because of side effects for valvular cardiac diseases. But basically, fen-phen is a combination of two medications. It's fenfluramine and phentermine. They took the fenfluramine off, which they found that it does cause heart attacks and valvular disease, but they went ahead and kept the phentermine on board. And I still write phentermine on a daily basis today. It is an appetite suppressant. It's great. It's a pseudoamphetamine, so it's legalized amphetamine. You feel stimulated, you feel like you can take over the world, and you stop eating. But that only lasts about 3 months. But when patients come to me and they ask for these medications, the funny thing to me is, why are we depending on this one pill to work on that one receptor in our brain to suppress our appetite? But in reality, we can eat certain types of food, do a certain type of activities that could very well distract us or decrease our appetite, but yet people depend on that one pill. So I spent, in the past 5 years now that I've been practicing weight loss medicine, that's really what I do in my practice, is to offer the options to my clients, but yet try to talk them out of taking the pill. And so for the next, 5 to 7 minutes that I have left, I do want to just give you a crash course on Nutrition 101. And this is what I talk to my patients about on every patient that I see in my practice, no matter if you come with a migraine headache or I'll serve your left toe. I don't care. You go home with a diet plan. And it's great. It's great information because it really sort of turn on that light bulb for a lot of my clients, because in our reality, I don't care what you come in with, I can relate that into a nutrition therapy or really into some kind of nutrition plan some way or the other. So with your pencils and notepads, I realize you guys are taking your notes. This is probably a good little starter point, and you can definitely take a little away from at least my talk, my short talk. Basically, everyone here today who are interested in weight loss, who's interested in weight loss? Those who didn't raise their hand are liars. I'm always thinking about weight loss. But anyways, to eat healthy, I don't want to put people on diet. I don't want you to think about dieting as dieting. Because in our reality, someone was telling me the other day, which he made a totally good point, who is my boyfriend, by the way. The funny thing, he wasn't supposed to come here today, and it's hilarious. He's sitting out in the parking lot waiting for me. So basically, it comes down to the fact, the word diet. When I put someone on a diet, naturally, the terminology means something that's short-term. I want to be on it for 3 months, and I would suffer, and I would live on this restricted diet plan for 3 months to lose the 8 pounds that I want to lose, and I'm going to regain it in the 4th month. But in our reality, I don't want you to think that way. I want you to think about lifestyle changes. What am I going to do today that's going to be long-lasting and permanent? So the first thing to do, really, the first thing that I want you to do, even start tomorrow morning, really think about what you're eating. Think about what you're going to eat and how many meals you're going to eat. In order for you to lose weight or maintain your weight, you have to eat 3 meals a day. Some people think, well, if I cut down 1 meal and just skip my lunch, I can very well save my calories. But the whole idea of eating to lose weight really holds true. Do not skip meals. Eat at least 3 meals a day. Rule number 1. Rule number 2 is, in every meal, there should be all the macronutrients, meaning protein, carbohydrates, and your fats. Now I'm going to give you some numbers. Carbohydrates, what are they? Carbohydrates basically comes down to complex and simple. Stay away from the simple, bottom line. Simple are your basically processed foods. Anything white, anything yellow, anything that came out of a bag or a box or in a can is pretty safe to say is simple. Complex carbohydrates are your fruits and vegetables and fiber. How many grams of that do you need a day? Basically 10 grams of fiber per meal. So that means about 30 grams per day. If you really want an exact number, is actually 26 grams for females and 38 grams for guys of fiber. But around about 30 grams a day is pretty good. Protein. Everyone's crazy about protein. I'm sure if you went to Whole Foods nowadays, there's 20 different brands of protein that you can choose from, but no one knows what to buy and how to buy it. Basically, protein powder is a nice protein supplement for those who hate to cook, especially for those who are professional working women nowadays. Protein powder replacement is definitely a key way in putting in the protein. But the recommendation for protein comes down to 0.8 grams per kilogram of your body weight. So if you are 190 pounds, you need to divide that pounds by 2.2 to get your kilograms. And then you get that kilogram, times it by 0.8, and that is the equivalent of protein, the number that you need per day. Now, once you get that number of how many grams of protein you need per day, you need to divide it by the meals that you eat. Let's just say you are a grazer and you love eating all throughout the day, which is totally fine. You can eat 8 times a day if you wanted to, but you're going to use that total number and divide it by the many meals that you eat. So that means you have to eat so many grams of protein every time you eat. We got the fiber, we got the protein, and now the carbohydrates. Normally, if we're not on a diet and we're just going along with our day, we don't really care what we eat, we normally eat about 250 to 300 grams of carbohydrates a day. And that includes your simple carbohydrates, complex carbohydrates, other refined stuff, and all your fruits and vegetables. But if you truly want to lose weight, just a quick, easy way of losing weight, you want to come down by about 50 grams of carbohydrates. So if you start reading labels, the label would tell you 1 serving of whatever you're eating has how many calories, and it also would tell you how many grams of carbohydrates that you're going to eat in that 1 serving of product. So if you add that up, you can eventually basically come down to maybe 150 to 200 grams a day. For example, a piece of white bread is about 14 grams of carbs. But if you eat 4 pieces of that in one sitting, basically, you can imagine it adds up pretty quickly. Next is fat. Recommendation is that you're supposed to eat about 30% of your calories each day from fats. But we're not talking about all fats. There's different types of fats. There's the saturated fats, which is usually found in your butter products, red meats. And the other bad fat that we talk about or we hear about are your trans fats, which are basically hydrogenated margarine, cookies, donuts, potato chips, things like that. Really, recommendation is you want to stay away from a lot of trans fats. Anything that's processed, anything that came out of a fryer, the French fries and a beer that we love so much during happy hour that I had yesterday, should be eliminated. And saturated fat, you're supposed to limit down to about 7 to 10% of your intake. But otherwise, you can really focus most of your fat intake to your good fats, which are your polyunsaturated as well as your monounsaturated fats. Nowadays, if you read the labels, they'll tell you the PUFAs and the MUFAs, which are your monounsaturated and your polyunsaturated. And those are all your good omegas, omega-3, omega-6. So once you got all your macronutrients down, then we think about all the micronutrients, like your vitamins and your superfoods, all the weird, crazy stuff like goji berries and seaweed. Who here have like over 4 to 5 different types of supplements on top of your multivitamins? Crazy woman, crazy woman, crazy woman. So, it's really funny. In her practice on Fridays, I met one of her patients, totally crazy. He came in with 30 different types of supplements, lined it all up on my exam table. And the funny thing was, he actually duplicated a lot of things. And he probably spends about over $300 a week in just taking supplements. And he's high class. He buys everything from Whole Foods, and everything's expensive. So when I sat down and educated him that you're actually doubling up on your omegas, now you're taking about 5,000% RDA's worth of it, and vitamin D and vitamin E, these are all like triple the amount that you need for your body. And he tells me, yeah, but my other doctor told me it's okay. So these are the things you need to sort of contemplate. Go home, look at your medicine cabinet, and just really reevaluate what you're taking and why you're taking what you're taking. And when you look at the labels, when it tells you 100% of your daily allowance, it really means that we've done the research. We're telling you now that this bottle and this one capsule has over 100% of what your body needs. And if you take more of it, that's fine. But you also have to realize there are side effects and toxicity as well. And when it comes to multivitamins and supplements, unfortunately, it's not FDA approved. So no one's really going out there doing hard data research on specific supplements, which could very well cause side effects. And this gentleman that I was seeing in Dr. Higashi's office comes in with a lot of fatigue. But he's taking a lot of CoQ10 and all kinds of omegas and things like that. But yet, at the same time, I had a good feeling that it was his supplements that were causing the fatigue and the tiredness and the insomnia. So I took him off probably 25% of his stuff, and he came in the next week and he felt a little bit better. So who knows? So really sit down and reevaluate what you do have in your cabinet, medicine cabinet, and basically read about it. Read about what you're taking, and don't always trust that one doctor who tells you that you have to take all these different random things. But those are the quick information on nutrition that I have for you today. And it really does, it sort of applies to most of the people in this room. And I can guarantee you, if you start eating differently just from today's talk, by cutting down on refined carbs and really increasing the fiber and the protein, I can guarantee you're gonna lose at least 2 pounds by the end of next week. And I'm sure you can Google and find me. I live in downtown LA. Thank you.